Hello students, today I will be discussing about some of the terms which are used in the subject psychiatry. So very important to know these terms, because without knowing these terms it becomes very difficult to understand about the conditions, because these mostly these terms are the ones which are going to explain about these symptoms in the patients. So today you will be learning about the psychiatric terminologies. Okay, so we have got many terms, okay, very important terms that you have to know. So we'll learn about each of it in detail one by one. So the first one is the upreaction. So what do you mean by upreaction? Okay, so upreaction is an emotional release or discharge of recalling a painful experience. Okay, so a person had a painful experience in his life. Okay, say for example, the child, okay, in the earlier stages of the development, he had a painful experience in his life, maybe the death of a person, or say for example, a girl. So she was, sexually abused when she was a child. Okay, it is a trauma to the child. So as a child grows, the trauma remains in the child's mind, in the unconscious level. So when a person, grows up, when she grows up, so there are certain situations, which are similar, but she is not able to, manage with the everyday stressors and everything. So what happens? This unconscious, what painful experience she had in her life, she would have kept it in the level of unconscious, but it will come to the, the present level, and the unconscious level can disturb the personality of a person. So in those cases, the person will be given a therapy called as psychotherapy. So this upreaction is one of the psychotherapies which is used as a treatment to release the painful experience of a person, to get all those painful experience of a person which is stored in the unconscious level, which is disturbing a person, it is brought to a conscious level of the mind, and it is released out. Okay, so the person will be, when we are very sad or when we are very upset, when we share our feelings to someone, we feel very good. Yes, we feel very relaxed. Similarly, when this therapy is done in a person, when this psychotherapy upreaction is done in a person who had a post-traumatic stress disorder, so in those cases, or hysteria, so in those cases, all the painful experience which a person had kept in the unconscious level of the mind will be brought to the conscious level. He will be releasing those to the conscious level of the mind through the emotional experience. Okay, through the emotional release, in a sense, when a person is saying all these things, okay, so he will express that in the form of emotions. Maybe he may cry, or maybe he may shout, or maybe he may scold. So such kind of trauma which a person had experienced, but he had not released it emotionally out, because of that a person is having a psychological problem. So those things will be brought to the conscious level, and the emotions will be expressed out. So that's how the person will become relaxed later on. So this abreaction therapy, it can be done by using a medication or without using the medication. So usually if we want to do by inducing a medication, so it is facilitated by administering medication called as lavender sodium 500 mg, which will be dissolved in the 10 cc ml of normal saline, and it will be administered to the patient, and it will be administered in a slow rate. Okay, the rate of flow will be very slow, because it can lead to respiratory depression, or it can lead to sleep. Okay, so that is the reason why it will be administered in a very slow So through this process, okay, it is a treatment that we use in the field of psychiatry. A person's unconscious painful experience will be released out to the conscious level by emotional response. Okay, the second term. So what is the second term we have here? Is the abstinence. So what do you mean by abstinence? Abstinence is voluntary refraining from behavior or the use of a substance that has caused problems in psychological, biological, cognitive or perceptual or spiritual belief of life, especially with regard to food, alcohol or drugs. So what is this abstinence? So when a person is addicted to certain food substances or alcohol or any kind of a drug and he wants to quit it or he wants to refrain from it, okay, when he is doing it voluntarily without anybody's pressure or without any without taking him to addiction center, he wanted to refrain from it voluntarily, independently, that is called as the abstinence. Voluntarily refraining from a substance of addiction. It can be food or it can be alcohol, it can be drug, because it is causing him certain problems. So what are those problems? Because of addiction, he is having a psychological problem or he is having a physiological or biological problem. Biological in a sense, some health related organ defect, what to say, problems in his body. Okay, diseases. So those are called as biological or physiological problems. Psychological problems are mental disorders. And we have cognitive problems. Problems with the cognition, is thinking, is memory, all those things. Okay, and spiritual problems like inability to trust God. So or over grandiosity. So in those cases, okay, when there is an addiction, a person will have these kinds of the problem like psychological, physiological, okay, cognitive or spiritual related problems too. Because of these problems, he wants to completely quit the habit of smoking or alcoholism. So when he does it voluntarily, that condition is called as abstinence. So it is the voluntary refraining from behavior or the use of substances that has caused problems in psychological, biological, cognitive or perceptual or spiritual belief of life, especially with regard to food, alcohol or other drugs. Okay, so next term, what is the next term? It is the addiction. What do you mean by addiction? Addiction. So if you see the term, the first letters add is to get attached. Yes. So addiction is a term used to define a state of dependence or recurrent drug intoxication characterized by psychological and physical dependence as well as tolerance. It is a state of living without a person. It can be living without a substance or living without particular attachment. It can be, yes. So what is this? Without this particular substance, a person cannot lead his life. That is called as dependence. Psychologically, physiologically, it is getting attached to a particular substance. Okay, that is called as addiction. So sometimes what happens in addiction, it can lead to a state of tolerance. So what do you mean by tolerance here? Even though he is taking, say for example, usually he used to smoke 10 cigarettes per day. So for some time, say 2-3 months, he was smoking 10 cigarettes per day, and these after the third month. Okay, after third month, even after smoking 10 cigarettes, he is not getting any kind of pleasure out of it. So he needs the extra cigars to get that kind of a pleasure. So tolerance is a term wherein a person may require an increasing dose of a substance or it is like the usual dose is not causing any kind of a pleasure, but that is why he may require an additional dose of a substance to reach that level of pleasure. Okay, so that is called as tolerance. So addiction includes both the terms of dependence. Dependence is a state wherein a person cannot live without it because it will cause physical or psychological symptoms, and tolerance is another term wherein you may require an additional dose of a particular drug or a substance or alcohol to reach the state of the pleasure. Okay, so this is called as addiction. So next one is aggression. What is aggression? It is an action, verbal or physical, for dealing with frustration and anxiety caused by not achieving the desired goal. Say for example, I have a goal to achieve. I am playing a carom board. Okay, I am playing an indoor game carom. So I want to win the particular game against my friend. So when I am losing, that is my goal, to win the carom. Okay, so when I am playing, say for example, I lost the first game, second game, third, constantly when I am losing or when I am not meeting my goal, I become very frustrated, I become very anxious. Why? Because I am not reaching the goal. Okay, so in that mood, or when I am in that state of mind, what I do, I will show my frustration and anger in the form of verbal or in a physical way. Maybe I may throw the coins and walk away from there, or I may just shout at my friend. So what is it? It is called as aggression. So it is an action which is verbal or non-verbal in the form of physical, okay, because of frustration and anxiety of not reaching a particular goal, whatever we wanted to. Okay, so that is called as aggression. So the next term is agoraphobia. So what do you mean by phobia? Phobia is an irrational fear towards a person, towards an object, or towards anything. That is called as phobia. Okay, phobia is without any irrational. Irrational meaning without any reason a person is getting scared of something. Okay, fear of dark places, or fear of a particular person or an object or a situation. That is called as phobia. Now, coming to agoraphobia, what do you mean by agoraphobia? It is defined as an anxiety about being in places from which escape may be difficult. It is a state of anxiousness wherein a person feels very anxious about being in a particular place wherein the escape from the place or from the situation is very difficult. Say for example, as students you will be given the presentations, right? So as students it is your requirement to finish your presentation. Say for example, tomorrow your madam gives you a topic to be presented in front of a group. Okay, so you know that you have to prepare your lessons well, you have to prepare your evidence well. On top of that, you're very much scared, or you're very anxious about facing the audience. But there is no other way for you, that you have to do the presentation, right? So initially it will be, it is common to have the anxiousness. Everybody has it. Nobody is expert to just go in front of a group and talk. But as in when we are doing one presentations, as in when we are doing, we that normal anxiousness which should be there in every person, that will wear off. But in spite of that, you feel, very much anxious. 10th time you're doing a presentation, you're still, as if you're doing it for the first time, you feel very suffocated, you feel very anxious about the situation. But still you're not able to escape from that particular situation, right? Why? Because you have to do it. There is no other way. So that is called as agoraphobia. Or say for example, okay, there is a person who is always scared of being in a group, social group. So what happens then? He goes for a function. Okay, they are all family members, they are all relatives, all friends. He feels very suffocated. He feels very suffocated to stand in a particular group. Okay, so that condition, he feels very anxious to stay in a situation, but he cannot escape from that. Escapism is difficult. That is called as the agoraphobia. Okay, so the next one is the akathisia. What do you mean by akathisia? So before going to this term, I want to tell you about the medication, right? So in psychiatric, we are giving antipsychotic drugs to patient with the psychotic conditions. So when the patient is on the antipsychotic drugs, it will cause certain side effects or adverse effects. Okay, very common major side effects of antipsychotic is the extrapyramidal symptoms. So if you take the extrapyramidal symptoms, EPS, okay, extrapyramidal symptoms, so you have got a list of symptoms like neuroleptic malignant syndrome, tardive dyskinesia, dystonia, or it can be Parkinsonian, okay, or this akathisia. Akathisia is one of those side effects of the antipsychotic medications. Now, coming to this term akathisia, it's a subjective feeling of motor restlessness manifested by a compelling need to be in constant movement, may be seen in extrapyramidal adverse effects of antipsychotic medication. So that is what I told you. It is one of those side effects of the antipsychotic medication, which is extrapyramidal symptom, wherein the patient's symptoms are characterized by restless movement, okay, motor restlessness. He is not able to sit in a particular place. He is very restless, okay, he cannot sit, okay, even though he wants to, control, but he is not able to control that. So unnecessary movements, restlessness, motor restlessness a person may have, that is called as akathisia. Okay, so the next term we have akinesia. Akinesia, very simple term to remember, right? So kinesia means movement. Kinesia means movement. Akinesia is lack of physical movement. Okay, so whenever a person is having, it can be age-related problem, or it can be psychiatric-related problem, or physiological-related problem. So when a person is not able to move, okay, there is a lack of physical movement, the term is called as akinesia. Okay, so the next one is the ambivalence. What do you mean by ambivalence? It's a coexistence of two opposing impulses towards the same thing in the same person at the same time. There are two opposing forces, okay, in the same person at the same time towards the same thing. That is called as ambivalence. So what is this? Say for example, okay, if you are a patient, okay, if you are a patient, you're walking on the road, you find two deviations, yeah, you find two deviations. You do not know which way you have to cross, whether you have to go to right or to the left. There is a big question, which way should I go? Yes, maybe initially you may go to the right, then again you'll have, a conflict in your mind, whether to go this way, no, I'll come back and I'll go this way, right? So that is a two opposing force or a conflict a person will have towards the same thing in the same person at the same time. Or say another example is when a person is sick, okay, he goes to a doctor. Yes, usually the doctor, the physician, he will examine you. He will ask you to just put your tongue out to check out your oral cavity, your tonsils and other things. So if you are a patient with ambivalence, initially when the physician asks you to just put your tongue out, you may put it out. And immediately you may take it inside because it is a question mark. Oh, should I put it out or should I take it in? So just doing it in and out, okay, because there is a doubt for you whether I have to do or not. Okay, there's a two forces or existing opposite forces or impulses where it's a question whether I have to do or not, yes or no. Okay, that is called as ambivalence. Okay, next term is amnesia. Amnesia is a very important term. Okay, so it is the partial or total inability to recall past experiences, maybe organic or emotional, in origin. So it is an inability of a person to recall his past experiences. You can say simply as it's a pathological impairment of the memory. Okay, it's an impairment in the memory. The past experiences of a person is having a problem. Okay, so he's not able to recall the past experiences. That condition is called as amnesia. It can be due to organic brain disorders, some pathology in the brain, okay, or it can be related to the emotional reasons, right? So in case of amnesia, we have two types of amnesia. One is anterograde amnesia, second one is retrograde amnesia. So what do you mean by anterograde amnesia? So amnesia of event occurs after the after the disorder is precipitated, in a sense. So today I'm having amnesia, right? Today I'm having amnesia, right? So I usually I do my work and everything. Someone comes in and asks me, what did you have for breakfast? So I'm not able to remember from morning what all things had happened. What did I eat? What did I do? From which place I came? I don't remember anything. That condition is called as anterograde amnesia. After amnesia had happened, I'm not able to remember anything, right? So second one is retrograde amnesia. What do you mean by retrograde? Retro means past. Amnesia of event which occurs after the episode of the disorder which has precipitated. In a sense, I'm not able to remember my past. Okay, all those things which is happening from morning after getting amnesia, after I'm being diagnosed amnesia, I'm able to remember. Okay, I'm able to remember what I had in the morning, even though it is in the evening or so. Someone asked me, what did you have in the morning for breakfast? I'm able to remember. That is also a part of past experience only. But if they ask me, when did you complete your 10th standard? I may not remember. That is my past experience. I will not remember what all had happened before I got the amnesia. Or they may ask me, which city are you staying in? I don't remember, right? So all these things are the examples for retrograde amnesia. So amnesia, very important. It's nothing but the pathological impairment of memory. Okay, we have two types of amnesia. One is anterograde amnesia and the second one is the retrograde amnesia. Okay, so the next term, what is the next term we have is energia. Energia. Okay, energia is nothing but the energy. Energia is lack of energy for day-to-day activities. We lack energy to perform day-to-day activities. So I'm feeling very depressed. I'm not, feeling to do my, grooming. I'm not doing well. I'm not feeling to eat. I'm not able to keep my house clean. So what is this? I'm not having the energy. I feel very fatigued. I feel tired. Okay, energy, lack of energy. Okay, even though I'm fit physically, but there is something which is, I feel very fatigue or loss of energy mentally. So because of that, I'm not able to perform physically also well. So inability or the lack of energy to do the day-to-day activities is called as energy. Okay, so the next term we have anhedonia. What do you mean by anhedonia? It's the loss of interest in and withdrawal from all regular and pleasurable activities. You can simply say it as loss of interest in the pleasurable activities. Okay, what is this? I don't feel interest, okay, to do any kind of the activities which I used to do before. I loved it and I used to do, but now after getting a psychiatric problem, I'm not able to do it. So what is this? Say for example, before getting this problem of depression, okay, before getting the problem of depression, okay, you know what is called as pre-morbid personality. When you collect the psychiatric history, we collect something called as pre-morbid personality. So what is this? Before getting a psychiatric problem, how was the person's personality? You're going to check. Okay, how was his attitude towards himself, towards others, towards society? How was his, various response to various situations? right? So this anhedonia, say for example, I'm a patient with depression, okay, my psychiatrist, he may ask me, so what are those activities which you used to do before, which is your, what is your passion, right? So I may just say, I love to do, previously I love to do gardening, or previously I love to do painting, or I enjoyed watching movies. Okay, so but now after getting the psychiatric problem, even though you put a very nice movie in front of me, okay, or a program which I love very much, I don't feel interested to watch, or I don't feel happy about it. I don't feel pleasured out of it. Or if you take me out for a garden somewhere, I don't like to go, or I just don't feel happy about going and looking at the various plants, or I just don't like to enjoy with my friends, but previously I used to do. So anhedonia is a condition wherein the person will have loss of interest, or he will have the loss of pleasure in the previously pleasurable activities. Okay, that is called as anhedonia. Usually you can see in case of depression and all, the person will have loss of interest, whatever his passion is, okay, trekking, or it can be, playing various games, all those which was hobbies and everything which is the passion. After getting a psychiatric problem, they are not interested to do that. They are not happy, even though they go to that particular situation, they are not happy about it. They don't get pleasure out of it. Okay, that is called as anhedonia. Okay, so the next one is the anorexia nervosa. Anorexia nervosa, very important term. Okay, so anorexia, you know very well, it is loss of appetite. Okay, loss of appetite. So what is this anorexia nervosa? It usually happens in the teenage period, right? So when there is during the teenage period, especially in case of girls, okay, especially in case of girls, they want to maintain a very good figure. Okay, zero size, we say. Yes, they want to maintain a very good figure. They want to look beautiful. So they don't want to put an extra fat on them, right? Fat on them. Okay, so normally it is good. Yes, so to be normal, to be in the normal weight, it is good. But underweight is not good. And being very much underweight just because that you want to maintain that figure is not. It is a psychological problem when certain practices are done. So what is anorexia nervosa? It's an eating disorder characterized by self-starvation, weight loss below minimum normal weight because of intense fear of being fat. Okay, so it is the voluntarily a person or the girl may stop eating food. Okay, starving, voluntarily starving. Okay, without eating any food. Why? Because she is having that fear, or she is having that phobia that she will become fat. Okay, because of which she uses she practices of not eating any food, starving. Okay, that is called as anorexia nervosa. Especially if you take even the celebrities, actresses, they are models. Okay, all these people, they may have the psychological problem, which is anorexia nervosa, just to maintain the body figure. Then the next term is apathy. So what is apathy? It's a dulled emotional tone associated with detachment or indifference. Okay, it's a emotional dullness. Okay, simple term we can say it is a dullness in the emotion, not able to express the emotion. That is called as apathy. The next term is the aphasia. So what do you mean by aphasia? It's a difficulty in the formulation of words, or loss of language ability, or it is the disturbance in the language output. So inability or a lack in the language output is called as aphasia. Inability to express verbally through with the language, that is called as aphasia, formulation of words, inability to formulate words and the language output. So the next one is associative looseness. So the term itself says associative looseness, meaning there is looseness in the association. Whatever a person talks or says, there is no association in his speech. So when I say the speech, even you can think that there is a loss of association in the thought, because whatever we think is the one what we call a talk, right? So that is called as associative looseness. Disturbance of thinking in which ideas shift from one subject to another in an oblique and unrelated manner. When there is a shift in our ideas, when a person, say for example, there is a patient with schizophrenia, especially you can see this in case of schizophrenia, associative looseness is a positive sign of schizophrenia, wherein there is a inability to, there is a difficulty, there is a disturbance in the thinking, wherein the person, whatever he thinks is unrelated, so even his speech becomes unrelated. So a person has got shift in the ideas, we can say flight of ideas, but those ideas are not related, they are not associated with each other. That is called as loss of association or associative looseness. Okay, next term is autistic thinking. What is autistic thinking? The thoughts, ideas or desire derived from the internal private stimuli or perceptions that often are incongruent with reality. Okay, so the incongruence with the reality, the thoughts or the ideas what we have, a person is having, okay, so everything is not related to the reality. That way of thinking is called as autistic thinking. The next term is avolition. What do you mean by avolition? It's a lack of motivation or inability to initiate the task. Okay, lack of motivation. Volition means a person is having the motivation to do something. Avolition is lack of motivation, inability to initiate certain tasks. This also you can see in case of schizophrenia and other psychiatric disorders, wherein the person is not having motivation, the internal motivation what we call to perform certain tasks, to do certain things. Okay, say for example, I want to brush my teeth. Okay, so if I am having avolition, the initiation or the motivation from within is not there to brush my teeth or to groom or self-care. There is no initiation, lack of initiation or lack of motivation to do certain tasks or activities is called as avolition. Okay, so in case of schizophrenia, in case of depression, you can see this avolition. Next term is battering. What do you mean by battering? It's a harmful or offensive touching of another person. Okay, without the permission of another person, if you go and even if you touch him, it is called as the battering. Okay, so it is a harmful or offensive touching of another person. Something which is going, the way you touch shouldn't harm a person. If the way you touch harm it's a motive to harm a person, it's called as battering. Say for example, you would have heard about the child's child battering syndrome. Okay, so when the mother is pregnant, if there is alcoholic husband, when the mother is conceived, also once in the evening he comes and hits the mother. Okay, indirectly he is causing the harm to the baby, even though he is not touching the fetus which is there, but he is hitting the mother, is called as child battered syndrome. Okay, so harming the baby, without even touching the baby, but offensive touching via mother is causing a battered child syndrome. Okay, that kind of causing harmful or offensive way of touching another person is called as battering. Next term. So next term is BPAD, bipolar affective disorder. So what is this bipolar affective disorder? So before going to bipolar, I'll just define this term affective disorder. So what do you mean by affect? Affect is nothing but the emotion. Okay, so affective disorder, you can say it as emotional disorder, right? So what are those emotional disorder? We have bipolar. Okay, so in the pole, if you take a pole, you have got two poles, bipoles, right? Two ends are there. So the mood of a person, you can say this affective disorder as a mood disorder also, right? So mood disorders, we have two different moods. One is a high mood, another one is a low mood. So two poles, one is high mood is there in one pole, the second one is a low mood which is there in another pole in the same person. Okay, so in the same person, there are two conditions. One is the mania, and the second one is the depression, right? You see, in the same person, that condition is called as bipolar affective disorder. It is characterized by recurrent episodes of mania and depression in the same patient at different times. In the same patient, you can see both the conditions of depression, characteristic features of depression and mania in the same person, but at different time intervals. Say, for example, for first 6 months, okay, if you say a person is having BPAD since 2 years, maybe first 6 months he had a manic episode, the next 6 months he had a depressive episode. So you can say it has two poles, okay, in the same person at different times. Okay, first 6 months mania, second 6 months he had depression. So that condition is called as bipolar affective disorder, BPAD. Okay, next term is bulimia. Very interesting, bulimia. What is this? Bulimia, it's an uncontrolled ingestion of large amount of food. Uncontrolled ingestion of large amount of food followed by inappropriate compensatory methods to prevent weight gain and maintain the body shape. Okay, it is similar to anorexia nervosa. So what is anorexia nervosa? There the person will not eat the food at all. Okay, self-starvation is there. But the goal is to lose weight or to not gain weight. That is the goal. Here also the goal is same, is not to gain the weight. But here the person is having the behavior of binge eating. So what is binge eating? Eating a large amount of food within a very short period of time. Within 2 hours, the person will eat a large quantity of, items, food items. Okay, especially what these people will choose is the items, the food items which are, the dishes which are very, sweet and which are high in fat content. Say burgers or donuts or pastries, cakes or chocolates or any kind of pizzas. So all such kind of food substances which are fat and sweet, such kind of food substances they will use. Within 2 hours, they will eat large quantity of food. They will just binge eat it. And once they do it, they will realize, oh, I have eaten this particular substance, I will gain the weight. Because of that thought or the fear of gaining the weight, they will do some compensatory mechanism like, okay, excessive exercises they may do or inducing vomiting, okay, to just purge out all the food substances, okay, in the goal of losing the weight. Or they may use laxatives, okay, to just release out whatever they've eaten. Okay, such kind of compensatory mechanism, excessive exercises or inducing vomiting, such kind of food practices or compensatory mechanism they will do to compensate the binge eating behavior because of fear of gaining the weight. Okay, so it is the uncontrolled ingestion of large amount of food followed by inappropriate compensatory methods to prevent weight gain for maintaining the body shape. That is called as bulimia. Okay, so the next term is the catatonia. What do you mean by catatonia? So if you split the word cata and tone, okay, so the word meaning of cata is the disturbance and tone is the tonicity of the muscle. So you can just say it as a disturbance in the tonicity or disturbance in the muscular ability of a person. So it is a state of psychologically induced immobilization at times interrupted by episodes of extreme agitation. So you can say totally there is a disturbance in the tone of a muscle or in the motor movement of a person. At times there will be rigidity, at times there will be agitation, restless movement. Okay, both things can be there at different times. That is called as catatonia. Okay, so the next one is circumstantiality. The next term is the circumstantiality. As the term says, circumstantiality, circumference. Okay, in the easy way you can remember. I'll just explain, read out this. A disorder of thinking process determining tendency is maintained, but the patient can reach the goal only after having exhaustive exploration of all unnecessary association arising in his mind. You can just simply say beating around the bush. Say, for example, you go and ask the patient a particular question. What did you have for breakfast? Instead of, straight way of saying I had dosa or I had upma, you may just say so many irrelevant things which is not related. Finally, he will give you the answer of what he had for breakfast. Say, for example, you ask him, what did you have for breakfast? He may just say, yesterday I went for a picnic with my friend. Then I went on an aeroplane. We came on the road, and I think your smile is very good. I had dosa in the morning for my breakfast. So what is this? After saying so many irrelevant things which is not related at all, finally he will come to a point. He will answer to your question. That is called as the circumstantiality. Okay. Next term is clang association. What is clang association? It's the use of meaningless rhyming of words, often in a forceful manner. In this, rhyming is more important than the context of the word. So it is the use of rhyming words in the speech of a person. When a person talks, he is using the rhymes. Okay. So, very rhyming words. What are rhyming words? Okay. Which sounds same, but it is different. Yes, the rhymes. You would have heard about rhymes, kids. Okay, so in the speech of a person, the person will use certain rhyming words. So these words are very funny to hear. Okay, yes, very funny to hear when the person talks in a rhyming way. Okay, so that which is not having any kind of meaning, right? So you may just talk like, I went in a van to have a pan. What is this? Use of rhyming words, okay, which is meaningless, which is very funny, okay, that is called in the speech. That is called as clang association. No association in whatever he is talking. He is using the rhyming words, which is meaningless. Okay. So next term is compulsion. What is compulsion? It's an irrational and repetitive impulse to perform an act. Irrational, repetitive impulse to perform an act. Okay. Irrational meaning no reason. Without any reason, a person is compelled, forced to do a particular action. Okay. Repetitive action. That is called as compulsion. Okay. Repetitive action without any reason. Irrational repetitive action is called as compulsion. Say, for example, washing the hand repeatedly without any reason. Say, I feel that, my hands are dirty. Okay, even if I touch anything, I just feel it is dirty. I go wash my hand again and again. Even if I come out, again I go and wash my hand. Repeatedly, I am performing a particular action. That is called as, without any reason, is called as compulsion. So I just, before going to sleep in the night, we lock the door. Okay, we lock it. Again, I go, open the lock. Again, I put the lock. So what is this? Again, repeatedly, I am performing an act. Okay, irrationally, it is called as compulsion. Okay, so next term is the confabulation. What is known as confabulation? Filling up of memory gaps with false but sometimes plausible content to conceal the memory deficit is called as confabulation. So, especially in case of a person with memory problems, say dementia, in case of dementia, organic brain disorders or amnesia, or in case of any other organic disorders, when a person is having memory deficits, he doesn't want to show that he is having memory problem. So, usually he is talking, suddenly there is a pause. So that pause, he doesn't, he has forgotten, there is a memory gap in the memory. He doesn't want to leave that gap. So he will fill that gap with certain false information. Okay, just to show people that he is not having a memory deficit. That condition is called as confabulation. Filling up of memory gaps with the false information, but sometimes plausible content to conceal. Conceal means to hide the memory deficit. That is a confabulation. Okay. So next term is conversion. What is conversion? Converting something from one thing to another. You are just changing. It is called as conversion. The transference of mental conflict into physical symptom to release the tension and anxiety is called as conversion. Converting our mental conflict in the form of the action physically, that is called as conversion. Say for example, I am having depression. Okay, so what do? I'm not interested in doing anything. So I sit in a place. Okay, so I just keep quiet. What is this? I'm having mental conflict. I'm having depression, because of which I am not able to. I will try to escape from my work. Okay, I will try to escape from my work, saying that I'm having stomach pain. Okay, that is called as conversion, or it is one of the defense mechanism, illegal defense mechanism, which every individual is using every day, but overuse of it is going to cause some personality disturbances. So converting the mental conflicts into physical symptoms is called as the conversion. Say for example, as students, very common, I'm having a test today. Okay, so I'm having a test today, I'm not prepared well. So what I do, I'm having a lot of stress, right? Those stress, I'm converting it into physical symptom. I'm saying I'm having severe headache or migraine, I'm not able to attend the test today. So what is this? I'm converting the mind or the mental conflict, the stress, into physical symptom of having the headache or migraine. That is called as conversion, to just escape from a particular situation, right? Next term is the crisis. What do you mean by crisis? The situation is an emergency situation in which the customary problem solving or decision making methods are not adequate to solve the problem. Okay, a crisis is an emergency situation wherein the usual coping mechanism. So for example, I'm having a problem. Okay, I use my defense mechanisms, right? We have list of defense mechanisms. Consciously or unconsciously, we use those defense mechanisms to protect oneself. Okay, whenever there is a problem or whenever there is a conflict, we use those defense mechanisms. So here the crisis, it's a situation, emergency situation. It's an unanticipated situation wherein you even try this usual coping mechanism to cope up with it, but still you're not able to cope up with that. Okay, you may require additional support. So that situation is called as crisis situation or crisis. Okay, emergency situation wherein the usual coping mechanism will not help you out to solve a particular problem. Okay, next term is cyclothymia. Cyclothymia, what is this? Cyclo is nothing but cycle. Thymia, mood. Okay, there is a swing in the mood, elation and depression. Okay, there is a mood swing. Okay, elation is mania and depression. Okay, so there is a cycle in our mood, mania, depression. That is called as cyclothymia. Next term is the defense mechanism. What is this defense mechanism? Defense mechanism is an unconscious mental process that the ego uses to resolve conflicts, which will abolish anxiety and depression. So it is the mechanisms which a person will use unconsciously to protect oneself, okay, in times of stress, in times of anxiety or depression. To protect oneself, he will use certain mechanisms to defend himself. Those mechanisms are called as defense mechanisms. There are a list of defense mechanisms, like we have denial, displacement, conversion, okay, so sublimation, okay, then we have probing. All these are projection. All these are the defense mechanism which a person will use unconsciously. Next term is the delirium. What is delirium? Is an etiology non-specific syndrome characterized by concurrent disturbances of consciousness and attention, perception, thinking, memory, psychomotor behavior, emotion, and sleep-wake cycle. So there is an etiology. There is a reason why a person is having this kind of a delirium. What is delirium? In simple terms, we can say it is a state of confusion, in terms of confusion or disturbances in the consciousness, It can be or higher mental function, disturbances in consciousness, attention, perception, thinking, memory, psychomotor behavior, and the sleep-wake cycle. All these areas are disturbed, or there is a confusion in this area because of some kind of a reason. It can be organic related reason, brain pathology. Okay, simple. Or you can say a person has met with an accident. Yes, he has a head injury. So he will be in a state of unconsciousness. So in those, situations, the person will be talking so many things. We say that something is wrong with him mentally. So what is this? Disturbance in the conscious, unconsciousness can be there. Disturbance in the conscious, disturbance in the perception, way he thinks, the way the memory he would have forgotten. Okay, all these areas, attention, all these areas will be disturbed because of a known etiology that is called as delirium. Okay, a state of confusion. Next is the delusion. What is delusion? Very, very important in case of psychiatry. This term, very important term, which is the delusion. It's a false belief, not true fact, and not ordinarily accepted by another member's explanation. It's a very strong, unshakable belief. Okay, it's a strong, unshakable belief. It's a strong belief. When I say strong, unshakable, someone say, if I'm having delusion, I am Goddess Lakshmi. Okay, if someone comes and says, you're not Goddess Lakshmi, no, I will not agree to it. Okay, I believe strongly that I am Goddess Lakshmi. If someone else comes and tells, I will not change my thought or idea of that I'm not a Lakshmi. Okay, even someone comes and says, no, it gives me a lot of explanation, gives me proofs and that and this, I will not agree to it. Why? Because I'm in a state of delusion. Delusion is a very strong, unshakable, false belief, okay, which a person is having. That is called as delusion. So, in delusions also, we have different types of delusion. Very interesting, different types of delusions we have. So, what are those? You'll be learning the types of delusion. The first one is delusion of grandiosity. What is meant by delusion of grandiosity? When I say grandiosity, grand, or we say grandeur. Grand means very much high. Yes, we feel very high, right? So grand in a sense, great. Okay, so a person is having a strong false belief that he is a great personality. He may just say that, see, I am certain God, I am God Krishna, Lord Krishna, or I am so and so, a goddess, right? Or I may say I am the scientist, Einstein, I am the scientist. I am the person who has invented this particular law, Newton's law. Or I may just say that I am the Prime Minister of India. I am Modi. Okay, so he himself feels great that he is having some kind of a supernatural power or some kind of a knowledge, intense knowledge, or very much high talent, or he is a great personality. So such kind of a false, unshakable belief is called as delusion of grandiosity. Okay, you can see these delusions in case of schizophrenic patients. Okay, delusion of grandiosity, right? So the next is the delusion of persecution. So what do you mean by persecution? It's a state of being harmed by someone. Okay, so here delusion of persecution, what a person feels is, he feels that always that he is going to be persecuted by someone. He is going to be murdered by someone. There's someone who is going to put this poison in my food, or there's someone who is going to, drug my food or drinks. There's someone who is spying on me. There's someone who is following me. Okay, so this kind of a strong, unshakable belief is called as delusion of persecution, that he or she is going to be harmed, killed, murdered, spied upon, or being followed. All these which is going to be harmed in some or the other way, poisoned, is called as delusion of persecution. Okay, so next type of delusion is delusion of reference. So what is delusion of reference? Here the person is having a false, strong, unshakable belief that whatever is happening around him, okay, is everything is referred to him in some or the other way. Say for example, he is hearing music, or he is hearing some kind of a news, or something. Okay, he feels that they are referring to him. They are referring to him and talking. They are or talking about him, or they are referring to about his particular action. Okay, and talking. So even here, so many people go and tell him, no, no, they are just talking about some other things. They are not referring to you. No, he will not listen. He's having a very strong, unshakable belief that people are talking about him, referring to him and talking. Okay, so that's what a person will have. There is delusion of reference. The next type of delusion is delusion of control. What is delusion of control? The person has a strong, unshakable belief that he is being controlled by someone else, that he is a robot. He is being controlled by someone else. That he is having a strong belief that his thoughts are controlled, his actions are controlled. Just like how a robot is being controlled by a remote control by some other person, he feels that his thoughts, his actions, everything is being controlled by some other person. That is called as delusion of control. Okay, so next type of delusion is delusion of infidelity. What is delusion of infidelity? Otherwise called as delusion of jealousy. Okay, here the person's sexual partner feels that he or she is not faithful to him or her. Okay, say if I'm having a delusion of infidelity, I may just have the strong, unshakable belief that my husband is having an extramarital relationship. Okay, yeah, I will start finding some proof for that. I will go and spy on him. I'll try to collect some proofs that he is having a relationship with some other lady. Okay, so what is delusion of infidelity? Is a delusion of jealousy, otherwise called as the person's sexual partner is not faithful to him or her. That is called as delusion of infidelity. Okay, so next type of delusion is delusion of guilt. What is delusion of guilt? Especially you can see in case of depression. Okay, a person feels that whatever is happening around him, okay, bad things, so many things are happening around him, that he feels guilty that it is because of him. Okay, so many unnecessary, so many events which are happening which is not good. He feels the guilty that because of him only these things are happening. That is a strong belief. It is called as delusion of guilt. Okay. So the next type of delusion is the somatic delusion. So what do you mean by somatic delusion? Somatic meaning it is body related, right? So a strong belief that there is something wrong happening with the body, right? So maybe he feels that his brain is rotting and it is smelling, it's melting, or he feels that his heart has gone from one place to another, it's moving inside, or he feels that his intestines are moving. So what is this? Or he feels some kind of things are crawling inside beneath his skin. So it is something which is happening to his body. So this is called as somatic delusion. It's a strong belief, even though he goes and he visits the various physicians and other things. They give him proof that everything is normal. There is no pathology found, nothing. No, he has a strong belief that there is something wrong happening. He's having some serious disorder. He's having HIV, or he's having cancer. He's having a serious problem with the body. That's what a strong belief the person will have. That is called a delusion of somaticity or somatic delusion. Okay, so next type of delusion is nihilistic delusion. It's a strong belief, false belief that he himself and the world around him is not existing. There's nobody in the world. There's no world. There's no people. There's no anything. No trees. No people around him. He himself is not existing. That a strong false belief that he is having, that he and himself, the world around him is not existing, is called as nihilistic delusion. Okay, so these are the different types of delusions that I have discussed. The different types, like I told you about the delusion of grandiosity, the delusion of persecution, then delusion of jealousy or infidelity, delusion of control, delusion of guilt, delusion of somaticity, that is somatic delusion, and nihilistic delusions. Common delusions that are very important to